Hello, and welcome to Animal Chiropractic Clinic Chatter, a podcast where Dr. O from All Creatures Every Spine interviews doctors and animal owners that utilize animal chiropractic to get their unique perspectives. Yes, it's really a thing. Dr. O utilizes his 30 years of experience as both an animal chiropractor and veterinarian, and to dig deep into the discussion of complex issues affecting the lives of your animal friends and companions. Join us for this educational episode.
Standard Process is a third-generation family-owned company in rural Wisconsin. You could say we just make nutritional supplements, but we know we're changing lives. We grow ingredients on our own certified organic farm without pesticides or herbicides because we think they should be as close to nature as possible. Quality is our priority. That's why we do everything right here, from hand-picking the seeds to delivery, so you know exactly what goes into every bottle.
Thanks for joining us for this portion of the episode as Dr. O begins to answer the question, what is animal chiropractic? He will look at how the chiropractic adjustment is a valuable and viable treatment for what ails your animals.
Hey Doc, it's more than animal chiropractic today. You're going to have to put your veterinary hat on. How do you know? Well, just because it is, it's more. We got all these other things going on. It's just not musculoskeletal. All right. The only way I can tell if something's chiropractic or not is to identify and remove all the vertebral subluxations. I have to Hey everybody. Hey Doc. Today, it's more than chiropractic. You're going to have to put your vet hat on. Hey, Doc, guess what? It's more than chiropractic today. You're going to have to put your vet hat back on. No, you don't like to very much, but you're going to have to. All right. I've heard that from clients a lot of times. And my question to them is, how do you know it's more than chiropractic? Oh, just because it is, it's not musculoskeletal. We're off of food. We've got some GI problems. Oh, it's pneumonia. We're breathing hard. All right. Well, those are all veterinary diagnoses. And maybe you even have a veterinary diagnosis from your traditional veterinarian, and that's okay. Not that I'm going to disagree with them, because that probably is there. However, it doesn't mean that chiropractic won't help. Not going to cure stuff. We're not going to cure myasthenia gravis. We're not going to cure, saw a dog yesterday that may have spina bifida. Well, I know it has spina bifida because it's breed. But is the adjustment going to help? Well, it did. The dog looked a whole lot better. Is it going to take care of all the symptoms that the dog's exhibiting? We don't know. The only way that I can tell whether something is animal chiropractic or not is for me to get my hands on the animal, for me to identify all the vertebral subluxations that are present in the animal on this given day, to remove those subluxation using a short but very effective thrust in the correct plane according to the way that the bones move and the way that innate set those bones up, so that I can restore motion, remove edema, remove swelling, remove pain from that area, and allow the nervous system to work at optimal levels. What happens after that? I don't know. I don't have a crystal ball. It's up to the body's innate ability to see what does with the adjustment. All I can do is deliver the adjustment to remove that nervous system interference and have it help. That's what we can do. Why? I saw a dog yesterday. It's a breed with a corkscrew tail. We've selected for spina bifida. Yep, that's genetic. We've chosen to make it so that their body doesn't have all the proper parts. Yep, that's genetic. What part of that, though, made it to where the dog has no bladder or bowel control? Don't know. Maybe he can't feel his butt. Is it because there's no nerves there? Or I found a massive subluxation. We had some severe dural torque going on in that dog. Dural torque surrounds the brain and the nervous system. Remove that dural torque, I don't know what's going to happen. We're going to adjust that dog 3 times and then see what happens. Maybe we'll need some x-rays, maybe not. We'll just have to see what happens. I don't know. I don't have a crystal ball. Dogs come in all the time. Horses come in all the time with diagnosis. Bowed tendons. Bowed tendon. Bowed tendon is because the muscle isn't working properly. Doesn't have the proper amount of tone in the muscle. How do we get muscle tone? Through nerve flow. Proper nerve flow creates proper muscle tension, proper tone. So what am I going to do? I'm going to adjust and remove the vertebral subluxations and see what happens to that muscle tone. The muscle tone should improve, therefore making the tendon work more properly and relieving the animal of the bone, of the bowed tendon, and having problems. So what are we going to do? We're going to find it using our hands and watching in our eyes, watching the animals move, see where they bend, where they don't bend, where they should move, where they should bend. Have to know, proper anatomy, have to know which way COC1 moves, which way C1, C2 moves, have to know all that stuff, have to know the range of motion so that I can know reduced range of motion. All this stuff is important in order to find the vertebral subluxations. Once I find it, then I need to know what the joint angles are, what the facet angles are as that animal moves, sits down, lays down, whatever, as I'm working on him. My LOC is going to change in relationship to me and the ground, but not in relationship to the dog. I have to understand how those things happen. I have to know that the horse neck depends on where the horse's neck is, where his head is. That COC1, that pole has to be in flexion in order for me to get a good lower cervical adjustment. If I can't get that head to flex up on the top, there's no way I can get a proper lower cervical adjustment. So I need to work and spend extra time on the upper cervicals. So find it, we fix it using our hands, and then we leave it alone. Because it took the body time to get sick, it takes the body time to get well. How long? I don't know. Rough guesstimate is about a half a day for every day that the body's been sick. When did the vertebral subluxation first happen? Most of us don't know. Yep, I was in a car accident 6 months ago. Yeah, but that may not be when it first showed up. That may have been what made it worse, what allowed you to see it. So anyway, find it, fix it, leave it alone, keep your dog adjusted. That's the only way you're going to know whether your dog has a chiropractic problem or not. Find it, fix it, leave it alone. Let your horse heal. Let the body do itself. That's the only way you're going to know whether what problem your horse has is chiropractic. You have to get your animal to the animal chiropractor and let the certified animal chiropractor put their hands on them in order for you to know if it's chiropractic. Have a great day. Keep adjusting.
Make sure to visit our website, allcreatureseveryspine.com, where you can subscribe to the show and learn more about getting your animals adjusted. If you are in the Meridian, Texas area, drop in on a Tuesday afternoon to get your animals adjusted. If that isn't possible, schedule a consultation on your animal's health with Dr. O. You can also purchase a copy of Dr. O's book. Yes, it's really a thing.
Helping others experience an abundant life with the gift, art, and blessing that is animal chiropractic is our sole mission at ACES. It's what we do. It's what we love. It truly is what keeps us motivated to help people just like you. I truly love the art of chiropractic. It drives me to providing the highest level of chiropractic possible. And as fellow chiropractic business owners, it's that love that drives us to become better. However, the reality is that sometimes running a successful business can be challenging. Sometimes there can be obstacles to overcome, right? Yeah, we all know the old saying, if it were easy, everyone would do it. Well, one thing that is really easy is marketing our clinic with a professional animal chiropractic website by the Chiro website pro, Tony Seymour. He's a professional web designer, and his team at the Chiro website pro take good care of us. They simply make marketing our practice 100% hassle-free. If you're looking for the number one hands-free way to market your practice, give the Chiro Website Pro a call at 423-779-4630 or simply visit www.chirowebsitepro.com and make sure you ask them about the special ACES discount and let them know Dr. O sent you. You'll be glad. Glad you did.
Join us as Dr. O interviews a certified chiropractor, veterinarian, or an animal owner. These enthusiastic people explain how they utilize animal chiropractic to alter the lives of the animals in their communities.
Hey everybody, welcome to another episode of Animal Chiropractic Clinic Chatter. I'm your host, Dr. O, and today I'm here with Dr. Laura. Dr. Laura, tell us a little bit about your practice and about you.
All right, Dr. O. So I work in the Midwest. I work for VCA, which is a corporate veterinary practice, and I work at a clinic in Des Moines, VCA Avondale. I graduated about 7 years ago from vet school, which is also the same time that I completed my chiropractic program. So I've been doing veterinary medicine and chiropractic since then.
All right. And a lot of people that are looking into adding chiropractic wonder about the corporate world. Are you doing your chiropractic outside of the corporate world or within your corporate?
I am doing chiropractic within my corporate. So VCA has been very supportive from the very beginning about chiropractic. They're also supportive about acupuncture. We have another certified chiropractor doctor at our clinic who does both acupuncture and chiropractic, and they're very supportive.
All right. So tell me what your biggest win has been with animal chiropractic.
Well, there's been a lot of big wins. I would say, you know, I have a couple of general categories that are always my favorite. So I do really like working with dogs that are involved in dog sports and seeing them being able to come back to competition. I also really like working with older pets who are geriatric and arthritic and can be helped a lot by chiropractic. I would say probably the most interesting case that I had recently was a really big win was a puppy who was about 7 weeks old. The breeder was actually a veterinarian, and he just had some unusual neurologic signs where his hind end, he was holding his hind legs together. He was wobbly when he walked, and she had taken x-rays and done blood work and couldn't find out exactly what was wrong with him, and asked, you know, do you think it would help if he was adjusted? And I said, yeah, I think it would help. And so she brought him over, and I adjusted him and contacted her the next day, and she said he had so much more energy the next day. He was able to run around without wobbling, doing a lot better, and he got adjusted, I think 2 more times, and now is running around as a happy puppy.
Cool.
Yeah.
Awesome. Yeah. So you mentioned that you enjoy dog sports.
Yeah.
So how are your dogs competing level wise compared to where they were if you didn't have chiropractic?
Oh, that's how I got into chiropractic. So my very first agility dog, I have Boston Terriers, and my first agility dog was fantastic. She competed at the national level, and one weekend we went to compete, and this is a very good dog, and we had 6 runs that weekend, and she missed her weave pull entry on 6 runs, and that was extremely unusual for a high level competition dog. And my trainer said to me, take her to a chiropractor. And I was like, oh, okay. I'd never been to a chiropractor. I didn't know they did animal chiropractic. And so, okay, well, my trainer knows what she's talking about. I'll take her in. And so I found a human chiropractor who is certified in animal chiropractic, and she adjusted my dog and kind of went through with me where the issues were. And I competed with my dog the next week, and she didn't miss any weave pull entries. That was literally the only difference, was that she got adjusted that week, and then she competed fantastically.
Cool. So, so all your dogs are getting adjusted on a regular basis.
Yes.
And do you find, so this is another question we have from veterinarians that are thinking about adding animal chiropractic. Well, when I go to the shows, I want to compete with my dogs, not adjust everybody else's dogs.
Yeah.
Do you have that? How do you handle that dilemma?
So I definitely fall into that same boat, because I do like to be involved in watching what my own dog does. And kind of the nice thing about VCA is that people can, if I'm busy warming up my own dog or whatever, people can always bring their dogs to me in the clinic as well. But I do have people like my agility trainer, people that I train with who know that I do chiropractic. So even if I'm not usually set up to do chiro at a trial, but I've been in the area long enough that people know I do chiropractic, and I can help them out if their dog's not running up to snuff.
Do you have rules? You have to have rules though, right? Don't talk to me,
Yes, exactly. You have to wait until my dog runs and she's gotten all of her treats, and then we can talk.
Yes. 30 minutes before, 20 minutes after.
Yes. I need my warm up and my cool down, and then we can talk.
Yeah, right. Because I can see, that's a real problem. I mean, I've been at a high school basketball game before. Not even an animal related event, right? Hey doc, my dog needs help now. Can you come help me?
Oh yeah.
But
that happens a lot.
Yeah, but that is the thing. So, what do you wish all the animal owners knew about chiropractic?
I wish people, that they had known about it in general. So I think a lot of people just haven't heard that animal chiropractic is a thing, which I understand, because I hadn't heard about it until my last year of vet school. But B, that it is something that can help every pet. So I am small animal, so I only see cats and dogs, but I do adjust both cats and dogs. And I see differences in my own pets at home. Even my male Boston Terrier, who's retired from agility, it's very consistent that I know when he needs to be adjusted, because he is typically this, races up the stairs. Whenever we're going up the stairs, it's a race to get to the top of the stairs first. When he needs to be adjusted, he starts going up the stairs one step at a time. I'm like, okay, and I usually adjust him every 2 weeks anyway, but sometimes he'll do something in between where he's chasing a tennis ball and kind of throws himself out of whack and starts going slow on the stairs. I'll adjust that dog and send him back down the stairs. And the very next time he comes up, he's racing like a wild man, like, just 5 minutes after I've adjusted him. And I wish people, that's what I would like people to know, is that even the things at home like that, where you're just noticing your dog maybe slowing down a little, or your dog having a little bit of trouble jumping up on the couch or the bed. I get a lot of those too, where people bring them in, he's just struggling to jump up on the bed. And a lot of times there's something going on in their hips, and we can adjust them and they do a lot better.
So, yes, it's amazing. The diversity, to me, I think, is the diversity of symptoms.
Yes.
That respond to chiropractic care. That we've talked about, in class and in, but you get so many, and you think they're unrelated. Like I had an older, Shar-Pei come in.
Yeah.
And the reason was that the Shar-Pei was having trouble getting comfortable at night.
Yeah.
And so I would adjust the dog once a month.
Yeah.
And he would sleep great. And when the dog finally passed about 4 years later, she wrote me a thank you letter and said, "Thank you so much for giving my dog care. Oh, and by the way, because she slept better the whole last 5 years of his life without drugs, but also never had an ear infection in that whole time and had chronic ear infections, quit urinating in the house."
Oh, nice.
And, old Shar-Peis, their curly tail gets kind of where it doesn't curl like that anymore. And oh yeah, his tail curled the whole time. So it's like all these things were happening, but you just knew, I just knew that all I was doing was helping the dog sleep.
Yeah. And I've had some of those tail ones too. Not necessarily a Shar-Pei breed, but some of the ones that the owner will come in because their dog isn't holding its tail right. And that's the reason they bring the dog in. And a lot of times, all the time of the ones I've seen, those are all chiropractic.
Yeah.
From all of the ones that I've seen in practice. And so that can definitely help. And then, sometimes I'll get pets that are having, the owner will bring them in because they're not eating as well. And, come to find out that they have neck pain. And
right.
So they're having trouble putting their head down. I've had some pets that come in. That's another one of my favorites, is the pets that come in that are just holding their neck down straight out. They're not lifting their neck. They won't turn it from side to side. It's almost like they're hunching up, and you can tell that they're painful and just won't move their neck, and it's chiropractic. And so you can go in and adjust those dogs, and they go home and, they're feeling a lot better. They're eating better, and they're not painful.
Yeah, I find that. So one of the things that we have started doing to illustrate that, for you, those of you in listener land, we forget sometimes that there's multiple facets of digestion and of not eating. And so what we usually think is if a person or an animal's not eating, it's because their stomach's upset. They have loss of an appetite. And so what we do is is, okay, so now I need you to sit on your hands at your next meal and eat with manners.
Yeah.
Well, you can't do that. And we forget the first part of food consumption is getting the food to your mouth.
Yes.
Whether you're an animal or a human, you know, if you have both arms are broken, humans going to have trouble getting food to their mouth. If a dog's neck is sore and they can't look down, it's very difficult to get food to their mouth.
Yeah, that's true.
And when we look at the way the back moves and the neck moves in the dog, in order for the head to go down, the back has to be moving pretty good. So
That's true.
So all chiropractic, and it helps a lot of them. I mean, I'm sometimes, even though I've been doing this for 20 some years now, I'm amazed sometimes at how well most animals respond to chiropractic.
Oh, I feel like I've been doing this for 7 years, and my coworkers will hear me say this all the time that, okay, well, I just cannot believe how fantastic this case is doing, because, I know that chiropractic's amazing. I've seen so many, amazing changes in pets, but, sometimes like this puppy that I talked about earlier, and I'm looking, this is really a neurologically abnormal, situation going on. And in my kind of Western medicine side of things, I'm having a hard time pinpointing why this dog can't turn his feet in the correct position on either of his hind feet. And does he have, a disc herniation or something, more traditional that I might be seeing that would be causing bilateral hind limb issues. And well, let's do chiropractic. We've tried, the other vets done x-rays and different things, and it hasn't worked. Let's try chiropractic. And some of these cases are just, they surprise even me, even though I've been doing it for 7 years, at how fantastic they do.
Yes, it is. And that brings up a point. I was just at the chiropractor the other day, my chiropractor, human chiropractor.
Yeah.
And I saw a sign on the wall, or a poster, and it said, adjust first, drug second, surgery third. And I thought, wow, that would be so cool, because you just said, well, they tried everything else first. And wouldn't it be neat if the first thing we tried was chiropractic?
Yeah, I think we would probably end up finding that a lot more of these issues can resolve with chiropractic instead of needing to go the drug route. I had my own dog. This was when she was 11, and so I'm adjusting her every 2 weeks. She was still competing in agility at that point. So I was adjusting her every 2 weeks, and I come home and she is non-weight bearing lame on the right front. Just would not put down that leg at all. And I went through and, so when you see a dog that's non-weight bearing lame, kind of the first couple of things that you think about is, well, maybe my dog needs some Rimadyl or some gabapentin or something, something along those lines, not putting her foot down. I went through and adjusted her, and it was her, one of her thoracic vertebrae had gotten basically shoved up underneath her, kind of up over to her scapula. And I think it was probably causing a nerve root signature. It was really painful. And so I went through and adjusted her, and she's like, whoop, better, on my way. And she goes from non-weight bearing lame to I'm going to trot off and do my thing. And so, I do, we do have a tendency to want to treat all those with medications. And, sometimes even those pretty bad looking cases can, all you have to do is adjust them.
We had one 3 years ago, Harley. You remember Harley?
Mm-hmm.
So Harley was middle-aged when you met him.
Yeah.
7 years ago.
Yeah.
So he's no longer middle-aged, and he quit eating
Oh,
and quit going up the stairs, and we were adjusting him, and it just wasn't. I mean, he'd get a little better, but just not, boom. So we thought, well, maybe it's time. I mean, he's getting old. He's 14, 15-year-old border collie, right?
yeah.
And he came from Border Collie Rescue, so we really don't know his history before he got to us, And we've had him probably 10 years, 11 years now, 12 years, I guess. And anyway, so we did some blood work, and it was normal. I thought, man, so we did some x-rays. And so we don't have x-ray facility here, so I'm at a veterinarian office that has a digital x-ray machine, and we took x-rays, and we're looking at the x-rays, and the traditional veterinarian is looking at his heart and his lungs and saying, well, those look pretty good. And I say, what? Wait a minute. And we went back, and he had a very unusual subluxation at T2, which is, like you said,
Really?
behind the scapulas, difficult to get to.
Yeah.
And it was actually, instead of being rotated or up, it was actually down. And so did some thinking how to get it, but we adjusted it and re-x-rayed him while we were still there.
Yeah.
And it was normal, in normal position. Brought him home, started eating, started going up and down the stairs.
Nice.
And that was 2 years ago.
Nice.
So it was chiropractic, even though he'd been getting adjusted. It was just a subluxation that was a very unusual subluxation.
Rare.
So we did the extra diagnostics, found it, but still we're not afraid to go back to chiropractic.
Yeah.
Because, chiropractic first, drug second,
Yeah.
surgery third. And, we've talked to a lot of veterinarians that are in practices, and they one of the problems that they have is deciding which ones to adjust and which ones to do traditional medicine with.
Yeah.
And I don't know if you have that issue or not, but after 7 years, it's probably getting a little easier.
Yeah.
But one thing I recommend when they start is have two hats. Have a chiropractic hat.
Mm-hmm.
You put that on first, and you go in and do your chiropractic exam and adjustment. And how many times as veterinarians do we say, let's try this pill?
Yeah.
So what I say, what we recommend is we say, hey, let's try this adjustment.
Yeah. Yeah.
And like you said, you got your Boston Terrier that's three-legged. Okay, so you come in and you adjust the dog, you put the dog down, boom, now he's weight bearing. Okay, great. We probably don't need drugs or surgery.
Nothing. Yeah.
Because as veterinarians, if we were going to put your drug on some kind of an anti-inflammatory, we should do blood work first to make sure everything's normal.
Right.
We should probably do x-rays, make sure there's no fracture.
Yeah.
So,
because she was completely non-weight bearing.
But if we put our chiropractic hat on first, man, how much are your clients going to know, like, and trust you now? So that when you do say, man, we need to do x-rays, boom, now they're more likely to listen. Say, yes, let's do that. When you say, hey, we need to do blood work so we can, because obviously the adjustment's not working. Let's see how the organ systems are working.
Mm-hmm.
And in our profession, know, like, and trust is huge.
Yeah. Yeah. No, that's true. That's definitely true. And I've had some, some good ones like that. I had one in well, probably a month or so ago, that had been at another, just at a different clinic in the area, and had been kind of worked up traditionally. And the dog's problem is that the owner said they'd just be sitting with the dog on the couch, and all of a sudden it would start screaming in pain and holding its left leg, and it would have these episodes like randomly, and the owner I don't know what's causing the dog to have these episodes. They tried pain medication, that their other vet had said, well, go try chiropractic. And so I adjusted that dog, and I just saw it back for a second adjustment 6 weeks later. And the dog's not on any pain medication now. The owner said the dog has been doing better than it's ever been doing in its whole life. And it's a 9-year-old dog. So he doesn't need meds anymore.
All right. Isn't that cool?
Yeah.
Because, not that there's not a time for drugs.
Oh, there are. Yeah.
But, as a little longer we can keep our animals drug free, the better off they'll be. And, like you said, you only do dogs and cats, but, every drug that we give our dog ends up in the environment.
That's true.
And every drug we give our food animals, our cattle, our sheep, our chickens, ends up in the environment and in the, and in our food supply. So those are all, man, if we can cut down on the number of drugs that we're putting into the environment, that's got to be better for the earth.
Yeah. Yeah, that's true.
So, because we need, I know we don't want flies in the house, but we have, we've got to have some of those bugs out there to keep things healthy.
Yeah. Yeah.
So, anyway, well, man, I enjoyed our conversation so much.
Me too.
Thank you so much for spending some time with us today. Everybody out there that's listening, remember, the body heals only one way: above, down, inside out. Make sure all the atlases in your house are adjusted. Until next time, have a good day.
Thank you.
If you are or know a veterinarian or chiropractor, or a student of either of these professions, visit our website, Animal Chiropractic Education Source, to see how to become certified in animal chiropractic. Start improving the lives of the animals around you.
Help your dog play again with Hero Braces. Hero Braces can create a custom stifle, carpal, or tarsal brace for your pet. That would be a knee, ankle, or wrist brace. Their braces are biomechanically designed by an orthotist or a prosthetist with over 15 years experience in canine bracing. Get a brace that is light, supportive, and effective. Help your dog play again. Check out Hero Braces at gohero.com.
Thanks for tuning in. Be sure to subscribe to the ACES channels so that you never miss an exciting episode.